Welcome. Today we delve into the world of unruptured brain aneurysms. We'll navigate this complex topic in a way that's simple and easy to understand. Whether you're a curious mind, someone who's been recently diagnosed, or a loved one seeking knowledge, this video is for you. We'll explore what an unruptured brain aneurysm is, discuss treatment options, and outline prevention strategies. Why? Because understanding is the first step to better health. Stay tuned as we unravel the mystery of unruptured brain aneurysms. An unruptured brain aneurysm, a silent threat, often goes unnoticed until it's too late. An unruptured brain aneurysm is a bubble or ballooning in a blood vessel in the brain. It's like a thin little sac that fills with blood. This sac can grow over time, like a balloon being slowly filled with water. But unlike a balloon, this sac is located in a very critical location, your brain. It's a silent threat because it doesn't usually cause any symptoms until it ruptures, which can be life-threatening. The causes of an unruptured brain aneurysm are varied. Some people are born with a predisposition due to a family history. Other causes include high blood pressure, atherosclerosis, which is the hardening of the arteries, and lifestyle factors such as smoking and alcohol use. Age is also a factor, as aneurysms are more common in adults. Now let's talk about the potential dangers of an unruptured aneurysm. The brain is a delicate organ, and any disruption in its blood supply can have severe consequences. When an aneurysm ruptures, it leads to a type of stroke called a subarachnoid hemorrhage. This is when bleeding occurs in the space around the brain. It's a severe and often fatal event. However, it's important to note that not all aneurysms rupture. Some just sit quietly in the brain, never causing any problems. The risk of rupture varies depending on the size, location, and shape of the aneurysm, as well as the patient's age, health, and family history of aneurysms. So what are the symptoms of an unruptured brain aneurysm? Well, as we said earlier, an unruptured aneurysm often doesn't cause any symptoms. But if it grows large enough, it can press on brain tissues and nerves, causing new headaches, eye pain, vision problems, or numbness and weakness in one part of the face. In some rare cases, an unruptured aneurysm may cause symptoms similar to a ruptured one, such as a sudden and severe headache, nausea, vomiting, stiff neck, blurred or double vision, sensitivity to light, seizure, or loss of consciousness. These symptoms require immediate medical attention. Understanding these symptoms and risks is the first step towards prevention. By knowing what an unruptured brain aneurysm is, its causes, potential dangers, and symptoms, you can be vigilant and take the necessary steps to protect your health. Remember, an unruptured brain aneurysm is a silent threat, but with the right knowledge, you can take charge and prevent it from becoming a silent killer. While the thought of having an unruptured brain aneurysm is terrifying, there are treatment options available. These options primarily fall into two categories: observation and intervention. Let's take a closer look at what each of these approaches entails. Observation is often the first step in managing an unruptured brain aneurysm. This approach involves closely monitoring the aneurysm over time to detect any changes that could indicate a higher risk of rupture. Regular imaging tests, such as MRI or CT scans, are used to keep a close eye on the aneurysm's size and location. If the aneurysm remains stable and doesn't pose a significant threat, this watchful waiting strategy may continue indefinitely. However, it's important to note that observation doesn't mean inaction. During this period, doctors will often recommend lifestyle changes to reduce the risk of rupture. This could include steps like managing high blood pressure, quitting smoking, and maintaining a healthy diet and exercise regime. These changes aim to improve overall health and reduce strain on the blood vessels. If an unruptured aneurysm is large, growing, or located in a particularly risky area of the brain, intervention may be necessary. This is a more proactive approach that involves medical procedures to prevent the aneurysm from rupturing. There are two main types of intervention: surgical clipping and endovascular coiling. Surgical clipping is a traditional open surgery that involves placing a tiny metal clip around the neck of the aneurysm to stop blood flow and prevent rupture. This procedure requires a skilled neurosurgeon and a general anesthetic. Endovascular coiling, on the other hand, is a less invasive procedure. It involves threading a catheter through the blood vessels to the site of the aneurysm. Tiny platinum coils are then placed into the aneurysm to promote blood clotting and prevent rupture. This option often has a shorter recovery time than surgical clipping, but it may not be suitable for all types of aneurysms. Choosing between observation and intervention, or between surgical clipping and endovascular coiling, is a complex decision that depends on many factors. These include the size and location of the aneurysm, the patient's age, overall health and personal preferences, as well as the expertise of the medical team. The key takeaway here is that an unruptured brain aneurysm is not a death sentence. There are effective treatment options available, and with the right approach, it's possible to live a long and healthy life after diagnosis. Remember, the best treatment option depends on many factors, including the size and location of the aneurysm, your age, and overall health. Prevention is always better than cure, and this holds true for unruptured brain aneurysms. Preventive measures are essential to reduce the risk of developing an unruptured brain aneurysm. These measures are generally focused on mitigating the risk factors associated with the condition. High blood pressure, for instance, is a key risk factor. Managing your blood pressure through a balanced diet, regular exercise, and prescribed medication can go a long way in preventing aneurysms. A diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain a healthy blood pressure. Regular physical activity, be it brisk walking or cycling, can also make a significant difference. Do remember, it's always wise to consult your doctor before starting any new exercise regimen. If you have been prescribed medication to control your blood pressure, it's crucial to take it as directed. Do not stop taking the medication without consulting your healthcare provider. Another risk factor for unruptured brain aneurysms is smoking. If you smoke, quitting is one of the best things you can do for your health. Quitting smoking can be challenging, but there are resources available to help, including counseling services and nicotine replacement therapies. Regular checkups are also a key preventive measure. These checkups allow your doctor to monitor your health and detect any potential issues early. Early detection can lead to more effective treatment and a better prognosis. Maintaining a healthy lifestyle is another important preventive measure. This includes getting adequate sleep, managing stress, and avoiding excessive alcohol consumption. A healthy lifestyle can not only prevent unruptured brain aneurysms, but also promote overall wellness. In conclusion, prevention strategies for unruptured brain aneurysms primarily involve managing high blood pressure, quitting smoking, regular checkups, and maintaining a healthy lifestyle. These measures not only prevent aneurysms, but also contribute to overall health and well-being. By taking these preventive measures, you can significantly reduce your risk of developing an unruptured brain aneurysm. In summary, an unruptured brain aneurysm is a serious health condition that requires our attention. It's a silent, often unnoticed ticking time bomb that lurks in the brain. Though it presents no symptoms, if ruptured, it can lead to severe health complications, even death. Two main approaches exist to manage this condition: observation and intervention. Observation involves regular monitoring and managing risk factors, while intervention includes surgical procedures like clipping or coiling. The choice between the two depends largely on the aneurysm's size, location, and the patient's overall health. Prevention is always better than cure, especially when it comes to unruptured brain aneurysms. Key preventive strategies include maintaining low blood pressure and quitting smoking. These simple lifestyle changes can significantly reduce the risk of developing an aneurysm. To wrap up, an unruptured brain aneurysm is not something to ignore. Knowledge is power, and understanding unruptured brain aneurysms could potentially save a life. Thank you for taking the time to learn about unruptured brain aneurysms. We've covered a lot of ground together. We've delved into what unruptured brain aneurysms are and how they can affect us. We've looked at the various treatment options available and the preventative measures we can take to manage our health. Knowledge is power, and by understanding more about this condition, we can better navigate the path towards maintaining our brain health. Early detection is crucial, and awareness is the first step. We hope this video has shed some light on this topic and empowered you with the information you need. Please, if you found this video helpful, share it with others. You never know who might benefit from this knowledge. Together we can spread awareness and potentially save lives. Please subscribe for more informative videos. Remember, your health is in your hands.